Hi, and welcome back to CBS Celeste Broadcasting Station. I'm Celeste, and today we have a very special guest, Lance Burrell, who is the lead healthcare provider and the nurse practitioner for the Winslow, Arizona State Prison. Welcome, Lance.
Thanks for having me, Celeste. I really appreciate the opportunity to be here and speak with you today.
Sure, absolutely. So tell us a little bit about yourself and the role you play in the prison.
Well, I'm a nurse practitioner. I've been practicing for about 18 years now, so I have quite a bit of varied variety of experience, is what I'm trying to say. And this comes in really handy working there in the prison. So I'm providing health care to the inmates, and you never know what you're going to get coming in. So it's you have to have the skills necessary to take care of whatever walks in the door.
Beautiful. I know that you've had a new electronic health record implemented to the prison. How has the new system affected the staff, and what challenges have you had to overcome?
Well, boy, that's a great question. The electronic health record, or EMS, electronic medical systems, are varied, and they all have their advantages and disadvantages, just like any workplace does. This particular system I'm not real fond of. There's some things about it I don't like, but there's some really nice things too. So it helps us to be more accurate in our charting, to capture information, and really one of the very nice things is being able to pull data from that charting when you're compiling data on all of the patients or the inmates there. The staff has been overall receptive. They've taken on the challenge of implementing this system. Like anything, there are challenges, but I think they've overall done a really nice job and are making do. And when they don't know how to do something, they call the IT help desk and figure it out.
Awesome. Has it been hard to get everyone motivated to this change?
I would say overall, honestly, not really. Frankly, it was, it's a system that's implemented actually statewide. So anybody in the state prison system, if they haven't already got it, is getting this electronic health record. And so we really didn't have a choice. I mean, either use it or find someplace else to work. I mean, that's the reality. So it is what it is, and the trick is to motivate people to see the advantages of it and help them embrace the change willingly rather than being dragged along and forced, because that's really what's happening.
Well, yeah.
So
I'd be figuring that out too. Are the staff willing to make the change and understand what they need to do?
again, overall, yes, I think they've been positive and motivated to learn the new system. There are a couple of employees that are turned super users, and they have a little bit more in-depth training on the system and how it works, and they've been very, very helpful. I know I have really utilized them a lot as I'm learning the system along with everybody else. And so I think really I've been impressed overall with how smoothly it went to go from the paper charts to the electronic health record. There's been bumps, certainly, but overall it's been, I think, pretty smooth.
Well, that's good. Fantastic. What other challenges do you see or noticed in the workplace?
Well, working in a prison has challenges for sure. There's actually some good things and bad things, again, like any other work environment. But we don't always have, the inmates are not always motivated to take care of their own health care. Plus, it's difficult with some of them getting medications and whatnot. The timing, because they have to. Boy, it's a complex question. Let's take diabetics, for instance. Because of the prison, they're not allowed to have needles with them in their cell. So anybody who's taking insulin has to come up to the health clinic to get their insulin, sometimes, 2-3 times a day.
Yeah.
And that just creates challenges,
Sure.
both for them and for us. So it could be worked around. I mean, on the other hand, they're not given a choice. So if they have to show up for medical for whatever reason, I mean, that's considered an order and they have to show up.
Right.
But, so like I say, it's a good and a bad. But they're not always, their attitude, I guess is what I'm trying to say, is not always the best and not always wanting to be in compliance with whatever it is we're doing. Whereas in private practice, somebody who's really not motivated and doesn't want to be there won't be there.
Right.
So you don't have to deal with them in that regard.
Interesting. Very interesting. And then one last question. As a leader in the healthcare field,
Mm-hmm.
what is the greatest advice you could give someone?
Well, the greatest advice, I think, for any leader, and it doesn't matter whether it's healthcare, anywhere, is to, number one, know your limits, know what you know, and have an idea of what it is you don't know, your strengths and assets versus your liabilities, okay? And particularly in those areas where you're not strong, get good people who have strengths in those areas around you to help or utilize them to boost your overall system and strengthen it. And then also in general, know that your staff can either make or break you. And so to be kind to your staff and understand that if they, and I shouldn't say they don't necessarily have to like you, but they need to respect you enough to want to participate in what they're doing. And if they do like you and respect you, they'll make your life easier and better. And if you've made them miserable, they'll make your life very difficult. So you need to treat your staff well with respect to them, and things will be better.
So give respect to get it.
Absolutely.
Golden rule. Okay.
Absolutely.
Well, thank you so much for coming on with me, and thanks for giving us a little bit of insight as your role in the healthcare field.
Well, I'm glad to be here. Thank you for having me.
Sure. And next up, we have the author of Our Iceberg is Melting. Stay tuned. Thank you.